Okay, exobasis. In order to see the exobasis, we need to remove the facial skull. You remember that? Yes, the facial skull, viscerocranium, is not part of the neurocranium external surface. So we are not able to see much on the anterior part. But in the middle part, the so-called jugular zone, do you know the borders? Here we had the borders of the three different areas. Here we have two lines. Shh, people, you're losing focus. This is one of the borders, yes, between the two zygomatic arches. The bizygomatic line, yes, is between the anterior or facial zone and the middle or jugular zone here. The big mastoid line right here, the tips of the mastoid processes connected, delimits the jugular zone from the occipital or posterior zone. Okay? So let's see what we have here in the jugular zone that we didn't discuss so far. We didn't discuss canalis caroticus. Canalis caroticus, of course, houses arteria carotis interna with plexus caroticus internus, connection via nervi caroticotympanici. You remember that we had canaliculi right there on the bone. You remember you studied last year, canaliculi caroticotympanici. Those are in fact the small tunnels that connect canalis caroticus with the middle ear, cavum tympani, in order to house nervi caroticotympanici connection with plexus tympanicus. Remember that, yes? Now, also, yes, as we mentioned, we have this plexus caroticus internus. That's in fact coming from the superior cervical ganglion, the sympathetic postganglionic fiber network. Now, the next one is fossula petrosa. We already talked about it. Foramen jugulare, fossa jugularis, we talked about it. Canalis, foramen stylomastoidem, we talked about it. Hypoglossi. Aha, we didn't talk about this one. What is that? What is it? Sorry? No. Sorry? No. Foramen ovale is right here. This big one. Spinosum is right behind it. It's right this one, spinosum. See?
Can you point again where you want?
Sure. This is the thing that I want you to see. What do you think?
Is it a foramen?
I don't know. You tell me. Should I point it on the other side as well? It's right here. Sorry? No. We talked about it. Just minutes ago we talked about canalis caroticus. It's a big one. Canalis caroticus, I mean. Of course, you will say, when I tell you the name, because that's usually what happens. Isn't it? Do you know this not so politically correct joke about the people who live near Niagara Falls? They do have their ears like that and their foreheads kind of flat. Why? Because every morning they wake up. What is this noise? The Niagara Falls. You know? So exactly what happens to you when I tell you that it's canalis musculotubarius. And you know about that. So, canalis musculotubarius, I think you should know. Isn't it? You remember that. Canalis musculotubarius is in fact what? It is an anterior opening of the tympanic cavity. It's on the anterior wall of tympanic cavity and in fact represents an initially bony tunnel within the pars petrosa that is continued, see here, by this groove. And this is called sulcus tubae auditive that terminates here at fossa scaphoidea at the base of the pterygoid process. Remember that? This is fossa pterygoidea between the two plates, the big one. And this is fossa scaphoidea. Yes? Canalis musculotubarius has a septum, bony septum that separates it into semicanalis and musculis tensoris tympani. Exactly. So tube auditive and musculi tensoris tympani. So one of the tunnels is filled by the muscle that does what? Tenses the tympanic membrane. Why is that important? And who innervates who? What branch innervates it? Via nervus pterygoideus medialis. Exactly. So the motor division will innervate from nervus mandibularis, musculus tensor tympani. Musculus tensor tympani, by tensioning the tympanic membrane, reduces its vibrations. So any kind of loss of function here will lead to what? No, exactly the opposite. Hyperacusis, meaning loud noises, because the tympanic vibrations are not dampened. Understand? Is there another muscle that you know from cranial nerves chapter that also has kind of the same function? Thank you, musculus stapedius, innervated by nervus stapedius from nervus facialis from canalis facialis, yes, and thus this one blocks or reduces the vibrations of the ossicles inside the middle ear, also reducing the intensity of the sound. Okay, so these are all sound control muscles. Good. So semicanalis tube auditive continues in sulcus tube auditive that reaches fossa scaphoidea that attaches the so-called cartilago tube auditive. Does this say anything to you? I don't think so. But I'm going to say something else that should. I'm going to tell you the name torus tubarius. Do you understand what I'm saying here? Torus tubarius. What is that? My watch says move, so I have to move a bit. We are done in a minute. So, torus tubarius. Pharynx, nasopharynx, lateral wall.
The fold next to the opening of the eustachian tube?
Exactly. It's not a fold, it's a protrusion caused by cartilago tube auditive that in fact is a hyaline cartilage structure. Hyaline cartilage is rigid, so it keeps the tube open. That's why we have the opening surrounded by this cartilage and bone. This is how the middle ear is aerated under normal conditions, because this tube is kept open by the presence of the cartilage. Okay? That inserts or attaches to the bony margins of fossa scaphoidea. Okay? Good. What else? I don't see anything else so pretty important. Let's just ask this one. This is pretty simple. It's canalis foramen, canalis palatinus major, housing what? The bundle, artery as well, isn't it? Comes from ganglion pterygopalatinum. The artery comes from the arteria maxillaris, one of the end branches of arteria maxillaris, and they supply the heart palate. We have the small openings, isn't it? Like one of these must be here. Canaliculi palatini minores, yes, for the same bundle that supply the soft palate. Good. Very nice. I think that should be it. We can stop the projection.